Hi everyone, my name's Steph and I'm the founder of the Butterfly Princess Send Initiative. You can find information on my Facebook page and also on Instagram. It's the Butterfly Princess Show. But today, as you know, I'm a league cancer champion for anti-cancer, and today I've been very lucky to secure an interview with Tracey, who's the breast cancer improvement lead for Bolton, Rochdale, Middleton and Haywood. And I'm very glad that we're doing this interview today because it's timed in well with Breast Cancer Awareness Month all throughout October. Obviously, if you follow anti-cancer online, they have like different events and stuff, and obviously the Bolton, Rochdale screening program who are on Facebook have like various different things as well. Obviously, it's very important that you do get breast screen when you're invited to your appointment, because in the UK, a woman's diagnosed with breast cancer every 10 minutes. It's the fourth common breast type of cancer in the UK. 55,000 women are diagnosed with breast cancer each year, compared to with 370 men, yet even though it's very uncommon with men can still get it as well. And unfortunately, 11,500 women die from breast cancer each year, compared to 85 men per year. So obviously, when you get your letter, please go and get checked, book your appointment, and obviously check your breast as well. But obviously, go for your screening appointment as well. And this interview is all about because I talk about disability taboo subjects with my Butterfly Princess Send Initiative, vlog and my partnerships. Obviously, so today we're going to be talking about how accessible the breast screening programme is for people with a wide range of disabilities. So I will now pass you on to Tracey, who I've described as the breast screening improvement lead for Bolton, Haywood, Middleton and Rochdale, and she's going to tell us a bit more about what her job is. The need for Breast Cancer Awareness Month throughout October, and why it's important to raise awareness among for disabled people within the disabled community, and the importance of early detection and NHS screening programmes for not only for disabled people, but the carers who support the disabled person. So I will pass you on to Tracey now, who will give you a bit of an intro.
Hi, thanks very much. Hi, Steph. Thanks for talking to me. I think you've introduced me very well, actually. Yes.
Thank you.
So I'm the breast cancer improvement lead, and I do cover Bolton, Rochdale, Haywood and Middleton. And my role really is to try and encourage ladies to come along for breast screening, not just disabled ladies, but anybody that's invited for breast screening. It's important that they come along and have their screening. So you've mentioned a lot of the things I was going to say, that 55,000 ladies a year in the UK will be diagnosed with breast cancer. But the good news is that by coming along for breast screening, 1,400 lives will be saved each year by the National Breast Screening Programme.
Thank you, Tracey. And now we're going to go into the interview questions. So, first question is, who is eligible for breast screening?
It's ladies that are registered as a female with the GP practice, and it's if they're aged between 50 and 71. So you'll get invited every 3 years to come along for your screening. Once you get to 71, you won't automatically be invited, but you can still self-refer every 3 years by contacting our office.
And how does the initiative work? Is there an option to choose a time and venue that suits the individual lady? And if so, so is the booking system easy to use, and is it accessible for ladies with a wide range of disabilities?
Well, ladies will receive a letter inviting them to contact us to book their appointment. But if somebody has a learning disability or a physical disability, they will get a letter with an actual time of an appointment on it. So they don't need to contact us. It will automatically tell them it's on a certain day at a certain time. If that appointment's not convenient, they can then contact our office, either by phone or by email if they're able to, and they can change that appointment. Now, the telephone lines are very busy, so if people do have access to the internet and can email, that's probably the best way for them to do it, and then people will get back to them with a different time. They can also book, where I cover Bolton, Bury and Rochdale, there are 4 different sites that they can go to, so they don't all have to come to Bolton. We have 2 in Bolton, 1 in Rochdale and 1 in Bury, and all the other screening services across the country all have different areas where they can go as well. And we also do some late nights to cover people that are working, and occasionally we run clinics on a Saturday as well.
And are all the breast screening centres fully accessible for women with mobility issues?
Well, where we screen, we don't have any mobile units, so all of ours are either at a hospital or in a health centre, so they're all accessible for people with a disability. Other areas that do breast screening, some have mobile units which might be more difficult for people in a wheelchair, for example. But if you're in one of those areas, the best bet is to speak to that screening centre and see if there's somewhere else where you can go to have your screening done.
What facilities are available at the screening centres for Black people with disabilities, i.e. hearing loops, hearing loops, level access disabled toilets, etc. And how can I find out what services are available before I go to my appointment?
Well, the units that we use all have hearing loops and they all have disabled toilets. Again, I'm not quite sure if it's a mobile unit in another area, whether they would have a disabled toilet or a hearing loop. I'm not really sure. The best way to find out is to either contact the screening unit that sent you the letter or the actual building if you're going into a building to have your screening done, and they'll be able to update you.
And thank you. If I needed assistance because of my disability, could I bring like a carer or personal assistant with me to be a screening appointment?
Yes, so since COVID has started, we are asking ladies to come on their own if they're able to. But obviously, if you need support, if you need a carer or you need somebody with you to help you, then that's absolutely fine. You can bring them with you.
And so now I'm going to talk about BSL, like British Sign Language, or like for people that are hearing impaired. Do I need to arrange an interpreter for my appointment, or will an interpreter be provided for me on the day?
If we know that somebody is deaf or hearing impaired and it's registered with the GP that they are deaf or hearing impaired, then we will organise a BSL interpreter to come along for them.
Thank you. And what if somebody's blind? Can assistance dogs come along to the appointment?
Yes, of course. They can bring the assistant dog with them to the appointment. The dog wouldn't actually be able to go into the room where the mammograms are taking place because that's an X-ray, but they could be outside and somebody would help that person go in and out of the room.
Thank you. What is going to make, so when obviously, if I was a lady of the age group and I received an invitation to a screening appointment, say if I was blind or hearing impaired, what's actually going to make sure, you know, that I can access that information? So like, is it in Braille or anything like that?
We don't actually have our letters in Braille, I'm afraid. So in that case, I think we're probably relying on carers or family members to read the letters for the ladies. If somebody has a learning disability, we send out letters in an easy read format. And if somebody speaks a different language, there is something at the bottom of the letters with a little link. And there's lots of letters on the Public Health England website that are in different languages.
Thank you. And so I've received my letter now, and I'm a bit concerned, you know, because it's maybe my first time going to a screening appointment. So is there anyone I can contact to talk through my concerns with before I actually go to my appointment?
Yes, if you contact the number that's on the letter, you will get through to the screening office and they will put you through to the relevant person, and that might be myself if it was Bolton, Bury or Rochdale. I can offer the lady support. I can even arrange to meet that lady at Bolton, Bury or Rochdale if that would help to sort of reassure them and give them a bit more information before they actually go in for the screening. I'm more than happy to do that.
What about assistance with travel? If somebody needed assistance with travel, like, you know, a taxi or a minibus or whatever, is any help provided towards travelling and stuff like that?
That isn't available every day, if you like. But what we do have is we have the 4 different locations. So hopefully one of the locations won't be too far from where somebody lives. If somebody is really struggling, I suggest that they contact us. And if there perhaps are a few ladies from one area that cannot get to the unit, we could perhaps try and sort something out for that. But it's not something that we would do automatically.
Obviously you hear from many women, you know, that breast screening is uncomfortable and it can be particular, you know, embarrassing or a bit uncomfortable. So would you say it was worse for disabled people, or like what support's available sort of thing?
Well, breast screening can be uncomfortable, and in the very rare occasion it might be a little bit painful for people. I think that the thing with disabled ladies is you need to keep very still when the x-ray is being taken, otherwise it will be quite uncomfortable. The one thing that I will say is if somebody is in a moulded wheelchair, they need to be able to transfer into one of our wheelchairs where the sides can come down so that we can get the machine down low enough to screen somebody. So it might be that they need somebody to help them move into another wheelchair, and that they also need to be able to lift their arms up for a couple of the x-rays. So there are some issues around ladies with disabilities, but we will do whatever we can to try and get the best outcome for them.
And obviously, is there any alternatives, you know, for any disabled women who can't physically have the breast screening programme? Is there any more options?
At this moment in time, no, I'm afraid there isn't. This is something that has been raised with Public Health England, and they are looking at this. The thing that we say at the moment is if somebody isn't able to have a mammogram, we encourage them just to check their breasts every month, so that if they see or feel anything that's unusual for them, they go to their GP and get referred in.
If the screening, say I've been to my screening appointment now and you know it detects something that's a bit abnormal, what are the next steps, and does this necessarily mean I have breast cancer?
Well, after somebody's been along for their breast screening, they should receive a letter within 2 weeks telling them whether everything is normal or not. Sometimes ladies are called back, and that doesn't necessarily mean that they have cancer. It might be that the image wasn't very clear. So if somebody's perhaps been a bit uncomfortable and they've moved when the x-ray has been taken, it's not very clear. Sometimes the mammographers might have seen something on the x-ray that they just want women to come back and have another look. So it might be that they take another mammogram, and it might just be on the one breast that they've seen something. They might ask if they could do an ultrasound scan, and depending what happens with that, they may even take a biopsy. Now, even if all of these things are done, that still doesn't mean that you've got breast cancer. It's a very low number. If you're coming regularly every 3 years for breast screening, it's a very low number of people that will have breast cancer in between. So it's really important that people come along, and even if something is detected, hopefully it will have been caught so early that it will be able to be treated, and people will be able to live a healthy life again.
Obviously, as we know, like with any screening program, there's going to be some women who are going to be watching this, who are going to like be a bit dubious and a bit wary of going for the breast screening appointment. So, what would you say to any woman who's particularly thinking, oh, I'll give that a miss?
Well, I mean, as I've said before, it is a little bit uncomfortable. It's not the best experience. You're never going to wake up in the morning and get excited about going for your breast screening, but it's literally a few minutes, and if it is painful or uncomfortable, it will be seconds, and those few seconds can literally save your life. So I would really encourage everybody to come along, but if somebody is really anxious or really worried, please contact us, and then perhaps I can go along with them and give them a bit of reassurance.
We know that some disabled people come from minority groups such as the trans community. So, what advice can you give to any like trans woman or trans men who's had gender confirmation surgery? Do they still need to attend regular breast screening or not, or is it a bit different?
Well, you need to be registered with your GP as a female, and then you will get invited. But if you're a trans man, but you're registered as a female, you will still be invited. And if you have breast tissue, we recommend that you attend that appointment. If you're a trans woman and you're registered as a woman with your GP, again, you'll be invited for screening. And long-term hormone therapy can increase your risk of developing breast cancer. So it's really important that you consider going for breast screening when invited. Now, if there's any confusion, or if somebody is registered as male, but they think that perhaps they should go for screening, the best thing to do is to speak to their GP, who can then talk to the screening unit about that.
Thank you. And obviously, just to finish off now, obviously, October is Breast Cancer Awareness Month. So is there any like messages you would like to share with the listeners of this interview? We're going to be listening to this online on my Facebook page, whatever. Is there any like messages you want to share with the audience?
What I would say is that breast screening is very fast and it's free. And if you are invited, please attend when you receive your letter. And if you want any further information, I have a breast screening Facebook page as well, which I'm willing to share with everybody, as well as if you look on the Bolton Foundation Trust Hospital website, there's a breast screening page on there, which has got lots of information. It's got things in different languages. It has easy information, things for learning and physical disabilities. So please just have a look around. There's lots going on during October for Breast Cancer Awareness Month. And really, we just want to say, if you are invited, please go along. It could save your life.
Thank you, Tracey. I would like to say thank you on behalf of me, the Butterfly Princess Initiative, but also I would like to also say thank you on behalf of Anti-Cancer, as this is what I'm doing the interview on behalf of Anti-Cancer as a lead anti-cancer champion. So all that's left to say, ladies, if you notice any difference in your breast, discharge, lump, swelling, anything that's unusual to you, you know, don't wait to get to your next screening appointment. Tell a GP at the earliest possible opportunity, because 1 in 8 women will develop breast cancer in their lifetime. Like I said, and I've got this off a poster, don't get a knocker shocker, you know, your boobs are really important, so please check yourself out, and if you notice anything unusual, go for your breast screening appointments, or in between that, if you notice anything unusual, please get it checked out. So thank you again, Tracey.
Thanks, Steph. I couldn't have said that better myself. Thank you.
Thank you.